everyone, welcome to Cancer Healing Journey Talks. Myself Sonali Modi from Community Outreach Team of ZenOnco.io and Love Heals Cancer. Cancer Healing Journey Talks help cancer survivors and caregivers to share their journey with vast number of survivors and caregivers who have traveled or been traveling through this journey. So this can inspire and motivate them for their faster recovery as well. Firstly, I would like to introduce today's speaker, Mr. Joel. He is a cancer survivor. I'm happy that you are here with us to share your journey, sir. Over to you.
Thank you very much.
Yes, please start with your introduction.
Well, I'm Joel Evans. I have been a professor for a long time. I'm now a professor emeritus, which means I'm retired, but I was at my university for 44 years full-time before I retired. I was healthy, exercised a lot, did a lot of things. And then in early 2015, I was diagnosed with pancreatic cancer. And shortly thereafter, I had Whipple surgery, then followed by 6 months of chemo. And I am one of the lucky single-digit percentage people that have lived for nearly 7 years after being diagnosed with pancreatic cancer. So I'm happy to be here today, share any insights that I can. To me, the most important thing is always see your doctor, get regular checkups, and get your blood tested. The best way to prevent any cancer or make the effects less is to get tested early and to listen to your doctor.
Yes. So what were the symptoms and how it got diagnosed?
I really didn't have any symptoms. What happened is that I had been a type 2 diabetic for about 20 years previously. And I would see my endocrinologist every 3 months, and he would do a whole range of blood tests. And I didn't even know what some of them were, but one of them was this thing called bilirubin. And he didn't like the score that came back. So if you want to feel that you get nervous, how about having your doctor call you at 7:30 in the morning at home and say, get right over to a center and get a CAT scan. So I had the CAT scan that day, went over to his office, and he started helping me set up with a gastro guy to do a sonogram, and then with the surgeon to do the surgery. So I had no symptoms except that he was doing a full range of blood tests every 3 months. And what he told me years after, because he didn't tell me at the beginning, was that even before I had further testing done, that he was convinced that I had pancreatic cancer, and that the faster I moved, the better the result would be, because pancreatic cancer spreads really fast.
Okay, yes. So what was your first reaction when you got to know that you are diagnosed with cancer, and how your family took this news?
So I kind of accepted it because I'm a rational type of person. So, and I think that it didn't set in initially. But my family was really upset, bordering on hysterical. And my one daughter was supposed to get married about 8 months after I was diagnosed. And she told me that, they were going to cancel the wedding and they would have a bedside service. And I said to her, you're not having a bedside service. You're not canceling the wedding. I'm going to be there. I'm going to walk you down the aisle. I'm going to dance with you, and we're going to do a toast. So she in particular, this one daughter was, kind of nuts. So the family had a tough time. But all my doctors were terrific. And the surgeon had told them, it's a really long surgery. I'm going to come out in the middle, and I'm going to give you a progress report so you have some idea how it's going. And he did that. And then when I woke up afterwards, I was totally out of it. And evidently he told me that I had a really good diagnosis because it hadn't spread to the lymph nodes. But I didn't remember any of that because I was, I guess, still doped up. So my family told me about that.
Yes.
But that was only
Family.
part of the journey because, I was in the hospital for 9 or 10 days. My wife, and this was February of 2015, my wife was all set to bring me home, and we then have a snowstorm. And we live about 40 miles from the hospital. So in addition to worrying about me, she's worrying about, driving and not being able to see. And I do remember that I got home and we have a multi-level house, and I went up to the bedroom and I basically flopped on the bed and I couldn't move because I had no energy left. So then a couple of months later, or a month later, I started chemo. And I did chemo for 6 months. And I was at first on a 3-drug regimen. And one of the drugs gave me a lot of trouble. I was throwing up. The skin on my fingers was cracking. So we stopped that one. And I did the chemo for 6 months. It wasn't, it wasn't awful. I was just tired all the time. And my white blood cells got low periodically, so I would have shots for that. And I had infusion for iron a couple of times. But I was fine. And I have, there's a funny story in there. So while I was doing chemo and I had to go for the white blood cell stuff, I used to do a lot of interviews on business for a local channel, a cable channel. And they would be 5-minute interviews. And they would come to my house and they would tape 4 or 5 of them at a time. So the previous week, the person had called and said, can we come out and do some interviews? So I said, sure. So that was Monday. I ran to the hospital, to the oncologist, which takes about 40 minutes, had my white blood cell shot, came back, put on my jacket and tie, and then did 5 interviews of 5 minutes each on 5 different topics. So that was interesting.
Yes.
So then I ended my chemo, and I end my chemo 2 days before my daughter's bridal shower. And I'm getting ready to go over there in between, excuse me, and see them. And I have a bunch of friends at my house, and we're going to all go over to the restaurant. And I passed out. And it turns out that my blood sugar had gotten too low because I wasn't used to the fact that I had gone from a type 2 diabetic to virtually a type 1, totally dependent on insulin. So I passed out. They had to take me to the hospital. It turned out that they told me afterwards that in the ambulance, my glucose level had gone down to 28. So they were amazed that I lived through the trip from the ambulance. And then evidently, because of the way I fell, it turned out that I needed to have cement put in my lower back because I did a fracture in between 2 vertebrae. And then 2 days later, I went back to my university because I had been on sabbatical for the 1 semester while I was sick. And I was determined not to miss any days. And I didn't miss any days for the 2.5 years that I continued to work.
Okay. Yes. So did you find any alternative treatment?
Okay. So I found when I was doing the chemo, I had my one daughter, my older daughter, who would go to a meditation class once a week. So I said, you know what? Let me come with you. I don't believe in a lot of the psychobabble stuff, but I'm interested in learning breathing exercises and how to relax more. So she bought me my own mat and my pillow, and we went over there, and we did it for a full year until her job changed and she couldn't go anymore, and I wasn't going to go without her. And I found it to be extremely relaxing. And there were breathing exercises that you could have that if you felt anxiety or anything, you could do the breathing exercises. And also they taught you how to close your eyes and to visualize so you could help relax your whole body. So I really did get into that. And I still remember the breathing exercises and how to close your eyes and visualize different colors and visualize your body. So I found that very useful.
Yes. So how did you manage your emotional well-being?
Well, I am a person who was fundamentally, optimistic. So not only when I told my daughter that I was going to be there for her wedding, and that was in October, and I was diagnosed in February, I really meant it and I really believed it. And I really believe that a positive frame of mind is the one other thing that can help somebody deal with something like cancer. You have to be positive. One of the mistakes I made early on before I had the surgery is that I went online and I went into discussion boards on pancreatic cancer. And all they were was negative. They were negative, negative, negative. And I said, I don't want to be in this. I want to be upbeat. So my motto is, live life every day for as long as you can, as well as you can. And I really believe that. And I have a lot of my friends who are amazed at how upbeat I've remained. And I've had, things that have happened. I'm sitting here today. I've broken my wrist, so I'm in a cast. But, compared to the events of life, in another 6 or 8 weeks, I'll be out of the cast and, I'll be back to normal. And I tend to focus on the things that I can do rather than the things that I can't do, because being depressed serves no purpose other than to make you more miserable. I really believe that. So having positive thoughts really helps. So the one challenge that has, lasted because of COVID is really not being able to travel at all. And my wife and I had our 50th anniversary last December, and we scheduled about 3 different trips, and we've never been able to be on any of them. So hopefully next year we will be on a trip.
Yes,
But
definitely.
I think it's also important to have short run as well as medium run goals, that sometimes we think ahead. I'm going to die. Well, we're all going to die at some point. But how about what task can I set for myself today? So I'm doing this interview. I have a couple of blogs that I work on. What could I do that's positive and that I can contribute with, and then extend them out? So I do volunteer work, which I've done for the last several years. So it's, setting goals, keeping yourself busy, having a positive frame of mind, and not listening to all the naysayers. So it's interesting because a couple of months ago, excuse me a second, I got to do a throat. A couple of months ago, I joined a Facebook group called Pancreatic Cancer.
Okay.
And, there are a lot of really depressing stories on there. But on the other hand, there are people that are just want to be comforted. They want to know that somebody else is out there, and has experienced the same thing. So it's another way of helping and giving back. It's not the sense of negativity from the discussion boards. It's a lot of conversations. And you could see that some of the posts could get 100 different comments from people. And I like to read them because most of them are from people who are survivors and talking about the fact that, you can do it. It's not preordained that you have to die within the next month from this.
Yes. So how was the experience with the doctors and other medical staff?
Okay, so with the exception of one, they've been great, because this is another thing that, this was 2015. This was not 1990 and 1980. So my expectations for doctors were not only that they be expert in their field, but that they be compassionate and patient oriented.
Hmm.
So the person who diagnosed me, which was my endocrinologist, he did everything. He set up appointments for doctors. He went and vetted people so it'd make it easier for me to pick. When I was at his office, I forgot to bring home the CT scan disc, and he says, he called me and he says, I live in your general area. I'm going to drop it off. What doctor goes out of his way to go and drop off a disc? And he was with me the whole way. And I actually got him a plaque with a clock on it that said, to the world's greatest and most compassionate doctor. And because he is very humble, he hangs it in his house, not in his office. So he was great. The gastro person he sent me to was great. The surgeon was phenomenal. The hospital was great. Everybody was great, except, so the surgeon said, you really need to do chemo. You don't need to do radiation, but you should do chemo. And let me recommend you to so-and-so, he's really top in his field. So I went to talk to that doctor, and he basically talked to me about how I'd be lucky if I lived for 6 months, and the likelihood was that I was not going to make my daughter's wedding. And I said to him, I just had this surgery with a doctor who's been doing this for decades, who said that it's the best result of any patient he's ever had. He was able to clear the margins in the pancreas. It had not spread to any lymph nodes, that he was very optimistic that I was going to have a long life ahead of me. So he then pulls out, on his computer, a study from about 1990 with 80 or 90 people in it. And he says, this is what research shows. And I said to him, wait a second, I'm an empirical guy. I do research. Tell me what the sample size is. Tell me when this is from. So when he tells me 80 or 90 and from 1990, I say there's nothing in there that's valid, because it doesn't reflect me. It reflects every person who's had pancreatic cancer, whether they were diagnosed late and didn't have surgery, whatever. What you're telling me is not meaningful. And he says, well, I'm just trying to be honest. And I said, that's crazy. So I said to my wife after that, there's no way that I'm going to go with him. So I then called my go-to guy, my endocrinologist, and asked him for a recommendation for an oncologist. And he gave me a recommendation, and it turned out that they were fantastic, and they never lied to me. What he said was, I cannot promise anything except that we will work as hard for you as you work for yourself. So I took that, so I formed relationships with the nurses there. And then I have an interesting story about chemo. So during the 6 months of chemo, the place that I went to had a lot of different size rooms. There were ones that had 2 chairs for people to sit at with TVs and everything, 4 chairs, and then 8 chairs. So I picked the one with 8 chairs. And my wife says to me, why would you do that? Wouldn't you want it to be quiet and watch TV? And I said, no, I want to be in my peer group, and I want us all to share our stories. And the amazing thing is we're all there with chemo. It's different types of cancer, but obviously we're all pretty sick, and we're all upbeat. And since I'm there a couple of days a week for months, you really get to know these people, and you're always asking, how's your family? How you doing? And everybody was just reinforcing. It was the best decision I made.
Yes. So what were the things that helped you and made you happy on this journey?
Well, the love of my friends and family, the support from my doctors, my own just state of being an update person. And, my wife has been unbelievable in this. It's been really hard on her. Everybody asks how I'm doing, but they rarely ask how my wife is doing. And this has been a tough almost 7 years for her, seeing me, lose 50 or 60 pounds, seeing me in a position where I'm throwing up all the time. I have terrible diarrhea. I have no energy. And, basically having to do everything for me, from dressing me to feeding me. And, even with it being better, she still worries. And I guess it was 2018, we went on a cruise of the British Isles. And we had made 2 stops. And we then went to Waterford, Ireland. And overnight before we docked, I started really shivering and getting cold. And I said, I'll be okay. And my wife says, no, you're going to the doctor. So we go to the ship's doctor. And he says, you have a high fever and we really need to get you over to the emergency room at the hospital. So they have to do everything involved with getting luggage off and getting us to the hospital. And it turned out that I had sepsis and double pneumonia. I was in intensive care for 6 days and then a regular room with people for 3. I was hallucinating. And so my wife is there for all of this. And in addition, she's got to book a room in a hotel, and other than visiting me in the hospital, be by herself thousands of miles from our whole support network. So that was really brutal for her. So it's important for us to be supportive of our caregivers. And I tell my wife all the time that I thank her, and I've done posts about her as a caregiver. And when I do something like this, which is break my wrist, it drives her crazy because she worries about me more. So the doctor actually said to her that she has a case of post-traumatic stress syndrome from all the stuff with me, and especially what went on in Ireland.
How you felt when you first heard that you are cancer-free?
Well, that's interesting. So they had said to me at the oncologist that every time I would go for a scan and it was negative, that the odds of me living longer were higher. So the first couple of years I went every 3 months. They had me do a port in my shoulder so that I could get the chemo drugs directly into me, instead of having to look for spots in my arm or my hand every time I went. And I found that people that did that, it was unbelievable, because after, going there a couple of times, the veins would dry up, and then trying to find a vein for them was horrendous. So I forgot what you just asked me now that I went off on my tangent. Could you say the question again? Do you remember the question? This happens to me a lot. This is what happens when you get old.
So how you felt when you first heard that you're cancer-free?
Oh, okay. So I would go every 3 months and have the CAT scan, and it would be negative. And after about 2.5 years, they said to me, you only need to get a scan every 6 months now, which is what I'm still doing. I have one actually scheduled for a couple of weeks. You can do it every 6 months now. And I said, could I take out the port, because the odds were that I wasn't going to need to have chemo again. So I had the port removed. And it felt good. We did a lot of traveling, except for when we had the trouble in Ireland. We did a lot of trips, which were really great. And, so when I hit the 5-year mark of my surgery, not the diagnosis, which was February 12th, 2020 was the 5th year anniversary to that. I did a blog post to myself on my 5th year anniversary of being cancer-free since since I had my surgery. But you know what? There's still a funny thing and a meaning ironic. And it's with most of the people that I talk to that are in a similar position to me, that they've had some form of cancer and they're several years out and theoretically, cancer free. And that is that, there's a small part of me, very small part of me, that says the next CAT scan is like a roulette wheel, that it could end up anywhere and it could still happen. So the week before I have the CAT scan, I still get nervous. Fortunately, the results are posted online 2 days after, before I see the doctor, and I see stable, good, blah, blah, blah. So
Yeah.
I'm optimistic. I feel good. COVID kind of got in the way, because that was just about corresponding the beginning of it with my 5th year anniversary. But I find that I'm in a position, now where I'm giving a lot of advice. I've done a number of interviews. I wrote a book on surviving cancer and embracing life, my personal journey, and I've taken it through to a 2nd edition. It was very cathartic writing that book. And I know that thousands of people have downloaded it and, have felt that my message, even though I've got all the things that I've gone through, is basically, it's an upbeat, positive message that I'm sharing with people.
Yes. So did you made any lifestyle changes during or after the treatment?
Yes. So I am unfortunately tired a lot. So I used to be a morning person. I could get up at 5 o'clock in the morning and have breakfast and be working before 6. And I am not a morning person now. It takes me quite a while to get going. And, my energy level isn't what I'd like it to be. So you have to work around what you could do. So it's funny, I started going to the gym when I turned 50. And I got to be a real fanatic. So I would do weights, I would jog around the track, I would do elliptical, all kinds of stuff. And I would go several times a week. I would have a trainer 2 days a week. But then since this happened, I really can't do a lot of that stuff, not because I can't do that stuff, but because I get tired. So I've turned to walking as my alternative exercise. And I walk for an hour, over 3 miles every other day. And I feel great. And I go up and down hills and I feel great. But, you have to, part of it, I'm 73 now, I am what I am. I'm not 53, I'm not 43, I'm 73. So some of the stuff with regards to what I could do or not do are related to just the natural aging process, but it's also compounded by my other limitations.
Yes. So,
but again, you have to make the best of it. The other thing I do is, because I've got I had rotator cuff surgery many years ago, and then I torn it again. So to avoid having surgery a 2nd time, is they devised a physical therapy program, an exercise program, where I reinforce the scapula off the back of my shoulders, so I don't need the rotator cuff as much. So other than the fact that I have this now, so I can't do it currently, but I would do 45 minutes of exercise on my shoulders and my body every other day. So one day I'd walk, the next day I'd do the exercises for my shoulders. So I'm actually in pretty good shape. My weight is good. I feel good. My plan is to be around for a while. I told my wife that my plan is to be around for many more years so I could aggravate you.
Do you think cancer has changed you in a positive way?
Oh, absolutely.
Means what life
It
lessons you
gets
got
me
from
to
your
be,
journey?
I'm less aggravated over small stuff,
Okay.
right? And I try to, I try to react only to things that are more important. So the things that are trivial, the everyday stuff, don't get aggravated over that. It doesn't help you at all. And I think, I had always made donations, because I believed that it was my responsibility to do that. But I become much more involved with volunteer work because, as I like to say, it's not that I feel a responsibility to give back. I feel that I must give back because I am really blessed because I had a cancer that, there's only 7% of us that are around as long as I am after that cancer. And I really must give back. So I'm involved mostly with two things. One is the Lustgarten Cancer Research Foundation. So I'm active with them. And the other one is United Cerebral Palsy, where before COVID, now it's by Zoom, but before COVID, I would go in 3 days a week and I would do all kinds of volunteer work. And this is, even though it says cerebral palsy, there were people who had Down syndrome, traumatic brain injuries, all kinds of things. And I would interact with them. I'd play games with them. We'd talk about all types of stuff. I headed the self-advocacy group so they could be more active in speaking up for themselves, and did that a lot and still do that through Zoom. So the thing is that they would always thank me for doing what I was doing. And I would say, I want to thank you because you're giving me a purpose in my life. And I feel that I am giving back. So it's not that you have to thank me for, being so generous to spend my time. I thank you for letting me do this because it makes me feel good while making you feel good. So it's one of those cases where it's a win-win.
Yeah.
So
So,
that's what keeps me going.
and how is
And
your
I'm
life after
also, even
cancer?
though I'm retired, I decided I wanted to teach one graduate course a year, and I've done that. So the first year I was retired, it was live. The last two, it's been by Zoom, which is not nearly as much fun.
Yes. And how is your life after cancer?
My life, to me, my life is great because I'm here and I can do a lot of the things that I would like to do. What happens is you just have to accept what the limitations are. So I could have periods where I have stomach issues. Because when they did the surgery, the surgeon was worried that because there was a spot in the middle of my stomach. Normally with pancreatic cancer, they take out 1/3 of the stomach. Because he saw the spot in the middle, he ended up taking 2/3. So that means my whole digestive, and they rerouted the intestines and everything. So my whole digestive system is kind of screwy. So 3 out of 4 weeks, I'm great. And then the other week it stinks. And I just say, it is what it is. I'm here. I'll take my medication and, I'd rather be here and dealing with this than not here. So it's a matter of, I think coming to peace with yourself.
Yes. What would be your message to other cancer patients and caregivers?
Okay, so with regard to patients, it's what I said at the beginning, make sure you have a doctor, get regular checkups. One of the things that's happened in the United States, and I believe around the world because of COVID, is that people go to the doctor less for routine things. So people haven't gotten the checkups that they would have gotten. They haven't had the blood work that they could have, that they would normally have done. So I think the fact that you need to see the doctor, you need to have blood work done. If you have a serious disease, almost across the board, the earlier that you detect it, the better off you are. Another thing is that when the doctor says, I'd like you to do such and such, I take that as I must do such and such, not a recommendation. So I know a lot of people, they go to a doctor says something and they go, I'll be fine. So you really have to take care of yourself. And if you have a scenario where you need to have surgery, have it. Don't be afraid of it. It's going to make you feel better. Yes, it's annoying. It's anxiety provoking, but it's also going to give you a quality of life afterwards. My quality of life is good. We go out, we travel, it's good. So I think there are a lot of people out there that are afraid of the doctor and don't go, and they don't want to hear bad news. So if they hear it, they don't pay attention to it. So I think it's being proactive and being upbeat. There was a person on this Pancreatic Cancer Facebook that had done a post that said, I'm starting chemotherapy tomorrow and I'm really nervous. All I read is negative stories. Can I read something positive? So I wrote my story out there and I said, the most important thing is to not give up. Don't give up. Keep fighting. Have a positive outlook. Set short-term goals. Give myself something to do today and tomorrow and the day after. And let's not get nervous. That's what's out there for 8 months from now. With regard to caregivers, I think the advice is for the people who interact with the caregivers more than the caregiver. There's a lack of recognition about how great a toll this takes on the caregiver. I think people don't understand that. Don't just ask how I'm doing. Ask how my wife Linda is doing. Call her up once in a while to see how things are going. Listen to her. It is really tough. This thing in Ireland, where I'm in the hospital in intensive care and hallucinating, and she's in a hotel room in a strange country by herself, was devastating for her. They thought I was going to die. I had sepsis and double pneumonia. So, even after I got out of the hospital and I got to go to the hotel where she was staying, the doctor wouldn't let us go home for another week because he wanted me to get my strength back to be able to fly. So I think that, we focus on the person with cancer, and I understand that, and we all want you to, be concerned about us, but we also need to be considerate and thoughtful about a caregiver. And if there's anybody who's ever dealt with somebody who had the chicken pox or something that was short term and how much they had to deal with just with that, multiply it by 1,000 times to come up with this. So another thing that keeps me going and my wife is that the Les Gordon Research Foundation had its walk on Sunday, and we raised a decent amount of money for them. We had a team called Team Joel, which unfortunately I couldn't walk at because of this, but my daughters and one son-in-law went and marched, and they raised a lot of money for cancer. So I think we have to look at the positive contributions we could do. It doesn't have to be money. It can be volunteer work. You could work as a volunteer at a local library. It could be almost anything. Things that make you feel good about yourself, but also help others. There's a lot we can do, but don't forget the caregiver. I love my wife. I tell her that every day, and I thank her every day.
And how did you overcome your fear of treatments or of side effects?
By not being afraid, by basically saying, if the doctor says do X, Y, and Z, I am going to do X, Y, and Z. And that I believe that I'm going to get through this. And I believe that before the surgery. And I certainly believed it after the surgery. So I really, I felt I had a lot of side effects from the chemo, but it never made me nervous. I never worried about, am I going to die tomorrow or the day after? Because I convinced myself that I wasn't. And as I said before, I really believed that I was going to make my daughter's wedding. And
So
being upbeat, just knowing that the doctor is going to take good care of you, that we trust the doctor, we check out their credentials, we look at their reviews by patients to see that patients like them, and we trust them. And my surgeon was great. He was fantastic, including the fact that because he had a lot of surgery, he would do his rounds really early. So he'd stop by to see me at 6 o'clock every day. So, having compassionate doctors helps a lot, and having doctors that know what they're doing. So when I went to, the oncologist after the bad experience interviewing the first oncologist, I love them. They were really nice to me. The nurses were nice. Being in that room with a lot of people where we reinforced each other. During the 6 months, there was one person who came in for the first time to get chemo and freaked out and ended up with her husband refusing to do it and leaving. So I don't know whether she ended up doing it or not, but her fear overcame what was the best thing for her, which is to get the chemo. And it's not such a big deal. You bring your Kindle or a book and you're basically reading for a few hours. You're bringing fruit or whatever it is you eat. If you've got somebody with them, you chat with them or the people around you. So there's a reinforcement factor. I talked to, I forgot about this. I had talked to several of my friends who I knew had cancer, had cancer. One who had ovarian cancer wasn't expected to survive a half a dozen times, who has. Another one who's a male who never smoked, who ended up with lung cancer, and several others, and talk to them about how they dealt with it. So there's a reinforcement with that when you have people who have things in common with you. Because I love my wife, she's great, she does everything, but she's not actually experienced the physical part of this that I am. And talking to other people who have gone through it really is helpful. I had a lot of long talks with my friends on that.
yes. So did you join a support group? If so, how did it help you?
I didn't join a support group, an in-person support group. I joined a bunch of Facebook groups, including one that was run by my oncologist. And I'm the most frequent poster there. I post the most there. But they also, at one point, they had asked me, because they have support groups, they had asked me if I would come in and speak to the support group about how I cope with things. So I found that was interesting too. So I think every time I talk with somebody like you, that's a support group, even though it's not officially a support group, because I get to,
Yes.
talk through everything.
Your story will then be seen by many other caregivers and survivors, and they will ultimately get a inspiration and motivation to fight back.
And that's what I hope that this provides to people, what my book provides to people, my blog, what my cancer blog provides to people. Every time I talk, at cerebral palsy, the patients, they know my story. So that's, they always ask how I am. And I said, I'm fine. I'm concerned about you. Don't be concerned about me. I'm okay. I just, even though I've had the 2 shots and the booster, I just don't feel comfortable, coming out there, even though they've all had shots, because my immune system, between the diabetes, being older, and the cancer, I don't feel comfortable. But we do Zooms.
Yes.
So they're my support group too. when I had knee replacement surgery in January of 2020. So they all, I don't know, there must have been 40 or 50 of them. They had a get well card that they all signed and they sent to me. So that's one of my prized possessions, is getting that get well card from that group with all the things that they have, from brain disease, Down syndrome, cerebral palsy, all types of things, some on breathing machines. So that, you know, they're an inspiration to me. They're really a support group to me too, as I am to them.
So at zenonco.io, we help cancer patients throughout their journey from diagnosis to forever. So what do you think about our work, sir?
About what?
About our work, means the work we do.
I think that it's very important to have cancer survivors who give back and talk about their experiences and talk about that there is life after cancer, and that we could be happy after cancer, and that we could do things after cancer. So I think that it's important that, you know, that we communicate to people doing what you're doing. You know, I do believe that these videos and every form of communication with people are really helpful. You know, going to the discussion boards where everybody is near death and all they are is down, nobody is positively reinforcing each other, doesn't help anyone. I really believe if you get depressed, it's much worse. You get much more down. You feel physically worse. You feel mentally worse. It serves no purpose to be down. So let's not be down. Let's think about the good things. Think of what we can do, not what we can't do. You know, I would have loved to have been in the Olympics when I was 25. I couldn't do that either, you know, but I could go out and I jogged 5 or 6 miles, you know, every day. So, you know, we do what we can do. We look for substitutes. You know, what we shouldn't do is just sit in our room and say, well, my life is over and I can't do anything. No, you can do a lot of things.
Yes. So do you have the fear of reoccurrence? And if yes, then how you can deal with it?
As the subtitle said in my book, you know, my personal journey is, you know, life is a journey. I've had a lot of things that have happened, you know, since the cancer. I needed knee replacement. About 6 months ago, I tore my rotator cuff again. I have this, and it's part of the journey. You know, I need to make the best of it and be upbeat for as long as I can. And I'm not thinking about, you know, when am I going to die? I mean, we all die at some point. My goal is not today, not tomorrow. But, you know, there are unfortunately accidents that happen where, you know, even young children end up getting into an accident. So I try not to think about the mortality part of it, because, you know, when it happens, it happens. And if it turns out that there's another incidence of this, or it goes elsewhere in my body, I will deal with it when that happens. It's going to be far worse for my wife and my one daughter than for me, because psychologically I try to blank out the things that are so negative, because again, I believe that if you have negative thoughts and you're miserable, you just make yourself more miserable. It's not a productive use of time. How about, instead of worrying about, I'm going to get cancer again, that I worry about, how can I be helpful to people today?
Yes. So what do you think about the stigmas attached to cancer and the importance of awareness for it?
You know, that's a really interesting question. So I had a lot of my friends who reached out to me and, wanted to be there for me. But there were a number of other people that I get the feeling that they avoided me. So when I went back to my university in the fall after I had my surgery, there was one person who I had probably known for about 20 years. When I came in the building, I saw him duck down the hallway and go the other way. And I said to myself, man, that's hurtful. Why would you do that? Why wouldn't you say, like everybody else is, how are you doing? And I think that, I had lost 50 or 60 pounds. And at that point, I had all the weight was still off. I looked really emaciated. I looked like, I thought my own self-esteem was low in terms of how I looked. But I just, I then a couple of days later said to myself, I think that he's afraid of interacting with me. And there's subconsciously, even though there's zero chance of this, of cancer may be contagious, that if I interact with somebody that has cancer, maybe that happens to me. So I think there are people that avoided me. I do think there is a stigma that there are some people who think that you're lesser. So, for example, as a professor, I was able to go in and do what I would normally do. All right. The difference is that the first semester I was back, I had to do a trade-off. Normally, I'd be somebody that would walk around the room, interact with students on a one-to-one, but I basically had to sit at the front of the room in a chair because I didn't have the energy to walk around the room. So I think that there's a stigma of people that are perceived to be sick or disabled. I think the cerebral palsy people have it much worse than I would. I think there's a perception, because mine isn't visible. If I were to walk down the street and see you, it's not visible. But if you're in a wheelchair or if you're on a breathing apparatus, there are a lot of people that automatically think that, then they can't think when it has nothing to do with intellect, and that they are handicapped. And so there is definitely, that's what we've done in that self-advocacy group, is we've watched videos, we've gone to meetings because of the fact that people just have a reaction that is not helpful. And again, in the case of people with wheelchairs, how many workplaces still in 2021 don't accommodate them, don't have elevators that are wide enough, don't have desks that are wide enough, flat floors. So I think anybody who's got something that's visible, just to strangers, they're not going to get great vibes. For those of us with cancer, people who know us, some of them think we're diminished, but my brain is not diminished. And that's always been my strongest attribute. And my attitude and personality haven't changed. And that's my strongest attribute. So yeah, there's definitely a bias. And I think at work, I was lucky that I was in a profession that I was able to have sick leave for that semester period. And that when I came back, I wasn't physically on campus 5 days a week. I was on campus the days I taught, and then the other days I worked at home. So I think a lot of people, when they recover from cancer and are ready to go back to work, are in a position, I guess, except for COVID now, where they go back to work, they're tired. And other people, I think, sometimes don't interact as well as they should.
Yes. So thank you so much for your valuable time. And
thank you. I hope to get a copy of this.
Yeah, I'm sure this session really motivates people out there who have traveled or been traveling through cancer. And it was lovely having you here today. Once again, thank you so much for the session. Yeah.
Thank you. And everybody be upbeat and live life every day. Bye-bye.